Hi Fiona, thanks for joining us today. We're going to talk a little bit about how you prepare your skin for treatment. So tell me about that, Fiona.
Well, one of the key ingredients that we advise in a cleanser or to prepare the skin are alpha hydroxy acids. So, for instance, in our own brand EYN, it's predominantly a glycolic wash, which is an alpha hydroxy acid.
So what is a alpha hydroxy acid?
Alpha hydroxy acids are acids derived from plants. So glycolic acid is derived from sugarcane, and there are others. So citric acid is from citrus fruits, lactic acid is from lactose, mandelic acid is from almonds. So they're plant-based acids which have an effect on the skin.
Okay, and what effect do they have, Fiona?
Well, the primary effect is exfoliation. So the surface of our epidermis, the stratum corneum, are dead skin cells. And as we age, the process of skin cell turnover slows. So the stratum corneum can become thicker, can make the skin look duller, enhance fine lines. We start getting age spots on the skin. So by exfoliating, and we're talking about chemically exfoliating skin with alpha hydroxy acids, the skin looks brighter, fresher. We can start to treat fine lines, even pigment changes. And we can also treat other things such as acne by this exfoliation that they can give.
Okay, so when you're young skin, I think collagen peaks at 25, doesn't it, Fiona? So after that, you build up, top layers of the skin, and the exfoliation removes that and makes your skin look younger. And I've just got
and it also, oh, you've got one there, yeah. So that's our Reveal wash, which is the glycolic acid, but it also has some salicylic acid, which is a beta hydroxy acid. So this will prepare the skin as well for other products, because it means other products are better able to absorb deeper into the skin where we want their action to be. The salicylic acid is a really good acid for more sensitive skins, for acne prone skins, because it will unblock the pores of sebum and bacteria which can cause acne, but also reduce the pore size. So this is a good wash for anti-aging properties, but also for younger, perhaps acne prone skins. But you do have to introduce it slowly. That would be the key point, is not to suddenly start using it every day if you've never used an alpha hydroxy acid before.
Okay, so salicylic for younger, more acne-prone skin, and this one glycolic for...
That's got both in it. So it's got glycolic acid and some salicylic acid. Yeah.
Okay. And when do you use it?
You would use that, you can use it morning and night. It will remove makeup. I know some people will just use it in the evening and don't use it in the morning. So to start with, I'd probably say use it every other day at night and build it up to every day. And for those who want to use the product twice a day, they can do that. It foams up, so it's a wash. You lather it up, put it on the face. If you want it to have more of an effect, you might leave it on while you clean your teeth. It starts feeling tingly, and its action is going to be a bit more than just washing it off straight away.
Okay, and what's it actually doing to the skin?
Well, it's chemically removing the stratum corneum by breaking the lipids between the skin cells. If you think it like the tiles of a roof, and they're not doing anything, it's breaking those off, and therefore promoting new skin cells from the basal layers to be generated to make the skin look brighter and fresher. So you're not going to notice an instant result with these products. I think the mistake a lot of people make is thinking after a week, oh, it's not doing anything. The skin cell cycle is 6 weeks, so you're going to have to stick with it for a few weeks before you notice more benefits.
Okay, so essentially you need to clean the surface, you need to clean the debris, those age spots, thickened skin, all that will be reduced with morning and evening with that. Okay. Yeah. So once you've done that, Fiona, the skin is then receptive to things going in, to absorbing serum. So what would you advise then?
Right, well, we're going to cover all the other treatment or repairing products in other sessions, but we wanted to look at protecting the skin, which almost is going from the first step to the last step. But in my mind, they're the bits that you really need to start a patient with. And prepare. If we don't prepare the skin properly, then we haven't we're not going to get as much benefit from the other products we used. And protecting the skin is possibly the most important step, particularly medically. So really, we want to talk about the last step and then look at what we can do in between those things.
Okay, so it's really 3 steps. So we said, it's a bit like looking after plants. So roses, so you weed them first, then you feed them, then you protect them. Yes?
Yeah.
So the weeding, the cleaning up, the removing the weeds is really... Okay.
Yeah, and if I have a patient who's not using any particular skincare brand or a mishmash of things, starting with the wash is a really good place to start. But again, you don't want to start them on everything all at once. So getting them used to using the wash, they'll see benefits with a product like this before you introduce the other products is a good way to start. But I would always equally want them to be protecting their skin at the same time.
Okay, so cleanse, wash, prepare, this is the one you need.
Yeah.
We talk about vitamin C and retinoids in another, that's the sort of feeding the skin, if you see what I mean. Yeah. Now we're going to focus a little bit about protection. So tell me, what damages the skin and why do you need to protect it, Fiona?
Well, we know that solar damage, UV damage, is the biggest ager of our skin, but it also can burn the skin and is a cause of our skin cancers. So very important. So using a broad spectrum SPF cream, I think, is probably the most important thing we can do, whatever age you are. So that would be the one product I would try and get everyone to be using.
Okay, so tell me a little bit about SPF. What does SPF mean, Fiona?
Well, SPF stands for sun protection factor, but it should probably stand for skin burning factor, because the number represents, if you're wearing, for instance, SPF 30, that how a measure of how much radiation is needed to burn or damage the skin compared to someone who's not wearing anything. So an SPF 50 confers more protection than a SPF 30, for example. If a skin it's classed as broad spectrum, that's implying that it's also protecting you from both UVB and UVA, whether the SPF number is only telling us about UVB. And that's really important because it's UVA that ages our skin, where the UVB burns and causes the cancers.
Yeah, so that's really interesting. So the UVA is the one we get off screens, we get every day, even in the winter, isn't it, Fiona?
Yeah, and also 95% of the UV radiation we face is UVA, 5% is UVB, but the number is only telling us really about the protection from UVB. And
does the number generally correspond to UVA as well? Do sunblocks protect?
No, not well. It can, but the other way of looking at it, you can see in England we often have a star system on the bottle. So 5 stars represents a high UVA protection. In Europe, it will have UVA in a circle to indicate that it's a broad spectrum and also protecting against UVA. So you want to look out for things that say broad spectrum and either have a star system or UVA indicated on the packaging.
Okay, and are many just UVB?
They can be, particularly if they're low SPF factors. So if they're low SPF factors and not conferring much protection against UVB, they're unlikely to also give protection against UVA.
Okay, so you'd recommend factor 50, UVA and B? Well,
I think that the official guidelines is they're factor 30 or above every day. But the difference between factor 30 and factor 50, I think factor 30 protects us against 97% of UVB. Factor 50, it's 98%. Now, some people say, well, that's just a percent difference, but it's 50% more. So we sell and use Heliocare, that's a factor 50. Our own EYN range, Protect, is also a factor 50. So yes, factor 50 is great, but factor 30 is adequate.
So this one, HelioCare 360, SPF 50, and it says against UVB again. Yeah, so it's both. That's good.
Yeah.
So this is a good one, yeah?
Yeah, so that's a mineral barrier sunscreen. And that's the other thing you want to consider is what type you want to use.
Yeah, tell me about that, Fiona.
So there are mineral sunscreens and there are chemical sunscreens. And I quite like the analogy of mirrors and sponges. So a mineral sunscreen is like mirrors. It's going to reflect the UV rays away from the skin, providing a barrier on the skin. Chemical sunscreens are like sponges. They absorb the UV into the deeper layers of the skin and change the UV to heat. So they work very differently, and there's advantages and disadvantages of both.
You know what I'm going to ask you now, Fiona.
Well, yeah. Well, the barrier sunscreens traditionally, which are titanium dioxide or zinc oxide, can be sometimes thick or have a white appearance. So traditionally people didn't like those for everyday use, but they work straight away. So as soon as you put the cream on, you can go outside. And now, particularly, for instance, the one we promote, HelioCare, is not thick or white. So it sits on the skin. It won't clog the pores. And it will protect you, but it is susceptible to sweating or washing off when you swim. So you might have to reapply a barrier cream frequently. The chemical sunscreens can be thinner, so more easily worn, but they don't work straight away. So you have to put them on 20 minutes before you go outside. They might not need as frequent an application because that you're not going to rub them off or sweat them off as easily. But if you've got sensitive skin or rosacea, you might find it doesn't suit your skin because of the heat generated, the way they change the UV. So those with more sensitive skins or rosacea are better with a barrier cream. Equally, some of the chemical sunscreens can promote acne in those who are prone to acne because they can block the pores of the skin. If you have a moisturizer with SPF in it, it's likely to be chemical. So if you've got a barrier sunscreen, you can't normally put other ingredients in with it because it sits on the skin. So it has to be an addition to your skincare regime. So for patients who want a fast regime where they're not using as many creams, they might prefer a chemical sunscreen that has other ingredients in it.
Okay, and what are the advantages to protecting your skin? Because I know there's been a lot of debate about vitamin D, hasn't there, Fiona?
Well, we know that UV light promotes skin or causes skin cancer, and that's been proven. So malignant melanomas, squamous cell carcinomas, basal cell carcinomas. So without doubt, even if we don't include aging, so wrinkles and pigment spots, there is an advantage to wearing an SPF. But what we also know is that sunlight is a source of vitamin D, and without vitamin D, in severe cases, you can cause rickets in children or osteomalacia, osteoporosis in adults. And we know vitamin D is beneficial to our immunity, which is topical at the moment with coronavirus. But we don't yet know how much sunlight is optimum for promoting those functions. All we know is that sunlight can cause skin cancers and skin damage. So the current advice is clearly not to use sunbeds, not to sunbathe, and that normal exposure on our arms, our faces, our necks when we're out and about is enough. And some foods have vitamin D in, or you can take vitamin D supplements. So I think if you are vigilant about wearing a factor 50 and you spend a lot of time indoors, you need to make sure you've either have a healthy diet with foods that have vitamin D in them, or consider taking a supplement as in addition.
Yeah. And what are high vitamin D foods, Fiona?
Well, there are a few foods that are high in vitamin D. So oily fish, so salmon, sardines, egg yolks has vitamin D, meat, particularly liver, has vitamin D, but most of our other foods are fortified, so they have it added. So milk, cereal, yogurt. So you're looking for those food groups that have it added to it.
And I've got a little supplement here, vitamin D.
Oh, yeah.
Can you take too much vitamin D?
Well, I'm sure you can. I mean, that's quite a high supplement. I think the recommendation for a normal adult is 600 or more units a day. That one is at 4,000, yeah. Which may be a dose that would be recommended in someone found to be deficient or who has osteoporosis or osteomalacia. But I don't know. The question of can you overdose? You can overdose on everything, but I wouldn't know. I would have to look up what the effects and how much you would have to take in order to have any problems from it.
Because I know with COVID, a lot of people think there's a relation between vitamin D deficiency and the severity of COVID, don't they, Fiona?
Well, I think that's because there is evidence to suggest that vitamin D has an immune function. It helps with our immunity and can protect possibly against things like any flu. And also there's an argument that it might protect against developing heart disease, even muscular sclerosis, types of arthritis. So without doubt, it's a vitamin that's beneficial. And particularly when there's viruses such as COVID around, there's no disadvantage to making sure we're doing as much as we can to make sure the disease or if the illness, if we get it, is minimal.
Brilliant. Okay, right, Fiona. So we're going to have a quick recap. So we talked about preparing and protection. So quick recap. Preparing,
looking for products with alpha hydroxy acids for anti-aging or salicylic acid for acne. This is our wash, which is glycolic acid. A really good way to prepare the skin for other creams and treatments, to look brighter, fresher, start treating acne, even start reducing dark spots or wrinkles on the skin.
Yeah. And Fiona, I'm going to be a model for you. So I don't normally do much skincare, but last night I did use this. And my kids said this morning, you look well. So so I think good to use if you can.
Yeah, so it will make a difference in that your skin will feel clean and fresh, but it will be a few weeks before you start noticing significant differences.
Yeah, so keep on with it. That's good. Okay, then we've talked about the things we're going to talk about the things you can add to feed the skin in another episode. So you're going to prepare it. That's simple. Okay, and then you're going to protect it, and there's a number of different solutions, aren't there, Fiona?
So there's either a barrier cream, which we really like, Helia Care, or we have the EYN Protect, which is our factor 50, which also has anti-aging ingredients. It's actually a chemical SPF. So we have the option there of advising whether someone would be better to have the Helia Care or whether they would be better to use the EYN Protect.
Okay, so last night I used the glycolic clean. Yeah.
Yeah.
Then we're going to talk about this later. Then I used retinol,
Retinol, that's retinol.
And vitamin C.
The vitamin C I would probably use in the morning, but we could,
So evening, morning.
Yeah.
Okay, can you use both at the same time, or do they sort of counteract each other?
You could, but it would be better to use them separately. So use your vitamin C before you put your SPF on, and then your retinol I would use at night. Yeah.
Okay, so once you've prepared, your skin is able to receive, it's open to receive things. Is that right?
Yeah.
So your serums can go in and do their good work at rejuvenating, and then protect your skin one way or the other with an SPF.
Yes.
Okay, that sounds really, really helpful, Fiona. So, do you mind me asking? Do you do this?
Yes, I do, and in fact, I even make my children use Helia Care, and my daughter has done since she was about 2, even smaller than that probably. So it's just part of their routine when they clean their teeth in the morning. They both put SPF on. That's
really good, and you can get different tints, can't you, Fiona?
Well, the Helia Care gel is a basic barrier gel, so that's the one we would use here. But it does come tinted, so there's a light tint and darker tint for people who don't want to wear foundation, have a bit of colour in the skin. The Protect, which is our SPF cream, the EYN cream, actually changes shade to match your skin tone. So it's very clever. It's got pigments in that will match any skin tone, but does give a sort of primer effect before you want to put makeup on.
Yeah, that is quite good. I think it's good for men, that one as well, after shaving and things.
Yes.
Yeah, you wouldn't
Yeah,
know
I
about
think
that.
again either would be good, but again it depends on what you're looking for out of your cream and what type of skin you've got as to whether the barrier cream is better or to have than the chemical cream. And then you've got back there's some debate about effect on the environment, which is the whole other thing with SPFs that we need to look at.
Tell me about that, Fiona.
Well, there is evidence. Initially, it was about oxybenzone, which is a key chemical found in chemical sunscreens, causing damage to aquatic life and particularly coral, so promoting bleaching of coral. So in fact, 2 years ago, I think it was Hawaii, banned the use of sunscreens with oxybenzone in them because they noticed that when people at the end of the day where tourists had been swimming, there was a sheen on the sea, almost like oil from all the sunscreen, and they were seeing it was having a detrimental effect on coral. Even barrier sunscreens, depending on the particle size used, has been found to cause oxidative stress on marine life. So we need to be mindful that what we use is using ingredients that are not going to do those things. So going into more detail about that. So possibly the barrier sunscreens, if they don't, can be kinder to the environment, but it's the oxybenzone in chemical sunscreens that particularly we want to avoid.
Brilliant. Yeah. Okay. Now, if people would like to find out more, Fiona, how, it's all a bit complicated, this, skin thing. Everyone's skin's different. How can people find out what the best sort of regime for them would be?
Well, they can ask for a consultation. So particularly at the moment, we're able to offer video consultations or phone consultations. So you can contact Cosmetic Courses on the usual phone number, so 01844390110, or via email asking if it's possible to request a consultation. And we can then set that up and look at what you're currently using, how might that be improved. We do have our online shop, so some information and products you'd be able to have a look at there perhaps first. So they would be the two ways I would look at doing that.
Brilliant. But I know you really feel, is it the simplest way? Is it the simplest thing to do to make you look younger and fresher? And
yeah, it always surprises me that patients are spending lots of money on the treatments that we're providing, and often their skincare regime is either using products that aren't highly effective, so are just marketing-based products with very little active ingredient, or they're using a mishmash of things, and too many products can cause as much harm as too few, so chronic inflammation and problems. So it's the sort of foundation. I think if you're starting to think about improving how you look or starting to use anti-aging treatments, you have to start with skincare, which means everything else will have a better effect. And it doesn't have to be a vast range of hugely expensive products. 2 or 3 key products that you start using regularly will make a difference. So that's what you want to start looking at.
Okay. And Fiona, give me an example of some of the things some of the products people are using which are wrong. The mishmash you said, or things like that.
It's the typical one is people say, "Oh, I just use soap," or then certainly not using an SPF every day. They think they just have to use an SPF when they go on holiday. They're using expensive products, but a variety of different products, or chopping and changing quickly. And as we said, 6 weeks is a skin cell cycle, so you're not going to see a difference for 6 weeks. You've got to stick with something for a good couple of months before you decide it's not suiting you or doesn't work. And using too many products, thinking that using more means they're doing more, but they might have 2 or 3 products that all have the same ingredients in them, or they might have a product that has very, very little active ingredients. It might say it's got glycolic acid, but it's a shop bought product that has very little in, as opposed to a product, say, such as ours, or what we call a cosmeceutical, which has a better amount of a higher quality ingredients in them. So it's just making sure that the main one is always going to be the SPF. So everyone should be on an SPF that they're using every day. They find one that suits their skin, that they're happy to wear. And from that, then adding the other things. The wash is what I would get people onto first. And once they're happy with that, then start adding the other products dependent on what they need. For instance, retinol would not be for everyone. Someone young does not need to start using retinol. Someone with sensitive skin doesn't need to use retinol. So it does have to be tailored to what your skin is, your skin type.
Yeah, okay, that's really interesting. So if we go back to the plant analogy, all plants need weeding, and all plants, that's preparation, and all plants need protection from the elements and whatever. What you feed them with depends on the type of plant.
On your plant type, yes. So carrots might need different feeding to your bushes than strawberries.
But both are going to need preparation and protection.
Yes.
Okay, so so if we think of the three things: preparation, protection, same for everybody. Everybody needs them. What is different and individualized is the middle bit, the feeding. The
middle bit, which can involve repair as well as treat. So treating can be repairing the skin as well as improving the skin, depending on what we're seeing. Yeah.
Brilliant. I mean, that's really interesting, Fiona. So thank you. I mean, great you've got your kids on it so early. Do you think they're going to be protected against skin cancer?
And will have no wrinkles when they're.
Do you think seriously, if you do that, you will?
Yes, without doubt. If you start using SPF early on, I mean, it's sun that causes the pigment and lots of our fine lines and wrinkles. Theoretically, using it vigilantly should mean you minimize signs of aging significantly, as well as your chance of developing skin cancer. So, but yeah.
Yeah, that's interesting. So if by doing that, you know, we're maintaining youthful skin, whereas it's more difficult, isn't it, to treat aging skin, to reverse the age, you know, sun damage is more difficult than stopping it.
Yes.
Brilliant. Fiona, thank you very much. Before we go, what do carrots need to feed?
Well, I do know that carrots you shouldn't plant in soil that has recently had manure, so they don't need too rich a feed in the soil. Yeah. Mine don't get fed with anything. They just get put in a bed that hasn't had mushroom compost or manure on it for the last year.
And you have fine carrots?
I had very big carrots this year, yeah.
Very, very good. Well done. So Fiona, thank you for joining us. I know you're really passionate about skincare, so thank you